How do you prepare for brain tumor diagnostic scans effectively? Getting ready for a brain tumor scan might seem overwhelming, but knowing what to expect can make the process smoother and more comfortable. The first step is understanding the different types of scans used to diagnose brain tumors. Most often, doctors order magnetic resonance imaging scans, which use strong magnets and radio waves to create detailed images of the brain. Sometimes, computed tomography scans are used, which involve X-ray technology. More advanced options like positron emission tomography scans or functional magnetic resonance imaging can also be part of the process, especially when detailed information about brain activity or blood flow is needed. Before your scan, your healthcare team will give you specific instructions tailored to your situation. It's very important to follow these carefully. For example, you should inform your doctor about any allergies, especially to contrast dyes, which are often used to highlight abnormalities in the brain. If you have any metal implants like pacemakers or metal fragments, tell your team because these can affect the safety of MRI scans. Your medical history, including medications and pregnancy status, will also be reviewed to ensure the safest approach. On the day of the scan, wear loose, comfortable clothing without metal zippers or buttons. You will be asked to remove jewelry, glasses, hairpins, or any metal objects that could interfere with the images. Lockers are usually provided to store these items securely. If a contrast agent is needed, it is injected into a vein to help make abnormalities more visible. Some people might feel a warm sensation or metallic taste during the injection, which is normal and temporary. Most scans do not require fasting, so you can eat, drink, and take your medications as usual unless your doctor advises otherwise. However, for certain scans like positron emission tomography, you might need to avoid eating or drinking for several hours beforehand and follow specific dietary instructions. If you have diabetes, your healthcare team will give you special guidance on managing your medications and blood sugar levels before the test. During the scan, you will lie on a table that slides into the scanner. The process is painless, but the machine can be noisy, so earplugs or headphones are often provided. It's important to stay very still to ensure clear images. If you feel anxious or claustrophobic, tell your technician. Options like sedation or using an open MRI machine might be available to help you feel more comfortable. After the scan, you can usually return to your normal activities immediately unless you received sedation. Drinking plenty of fluids helps your body flush out the contrast dye. The results will be reviewed by a radiologist and shared with your doctor, who will discuss what the images reveal and what the next steps might be. For specialized scans like functional MRI or diffusion tensor imaging, preparation is generally similar to standard MRI procedures. These scans help map brain activity and nerve pathways, especially before surgery, to avoid damaging critical areas. Magnetic resonance spectroscopy measures brain chemistry and can assist in distinguishing tumor types, while perfusion MRI looks at blood flow in the brain. For positron emission tomography scans, fasting and dietary restrictions are important, and a radioactive tracer is injected to help visualize metabolic activity in the brain. To prepare effectively, arrive early to complete paperwork and settle in comfortably. Bring a list of your medications and any relevant medical records. Let the staff know if you need assistance, such as interpreter services or mobility support. Don't hesitate to ask questions about the process so you understand each step. Following your healthcare team's instructions carefully ensures the scan is safe, effective, and provides the clearest images possible. This accuracy is crucial for diagnosing the tumor correctly and planning the most appropriate treatment. Remember, every person's situation is unique, so always communicate openly with your medical providers and follow their guidance. Proper preparation not only helps with accurate diagnosis but also supports your overall safety and peace of mind during this important step in brain health care.